This is the Optimal Wellness Podcast, helping you achieve optimal wellness naturally, with your host, Dr. Clifford Fetters of Health and Wellness of Carmel.
Welcome back to the Optimal Wellness Podcast. We are here with Dr. Fetters, as always, and I'm Cassidy Waters. This month of May, we are all most likely struggling with allergies. I think it's really hard to define what allergies is exactly and what causes it because so many people suffer from it. You don't really know exactly where your symptoms are coming from. So when it comes to holistic versus traditional, how would you treat both of those?
Right. So holistically, we treat the root cause. The root cause is inflammation. So inflammation is always from the same thing. So with asthma, the biggest concern is your genetic code. There are some people who don't have allergies don't even believe it exists. You know, me being a person with allergies, I need my windows up all the time. I'm with someone I don't know too well. They have their windows down. They really can't comprehend how having the windows open makes a difference. Yeah. So we're called under-methylators. That's what makes us strong-willed and perfectionistic. In the holistic world, everyone has the methylation circles everywhere, because when you get those wheels of methylation turning, our allergies and everything gets better, including inflammation. So it's really our genetic code. So the first step is you need to be methylating. That's why all our vitamins, so why are your vitamins more expensive than Walmart? Because methylated vitamins are more expensive. Most people know about the MTHFR mutation. We can't break down folic acid. So there's a already broken down folic acid, and then that negates the problem you have with that mutation. So when those wheels are turning, you make methyl groups, and methyl groups turn on and off your genetic code, take away inflammation, help you make hormones, helps your immune system. Okay, so if you're an undermethylator, first you got to do is start getting methylating. When you do that, you can handle allergies so much better. And then, I talk about heavy metals all the time. Heavy metals just shuts down the methylation cycle. That's why people want to biohack. It's like, well, until the system's working, there's no reason to supercharge something that's not working in the first place. Yeah. Okay, so once you get yourself methylating, then the other things you do is avoid the triggers. Right now, oh my gosh, everything is blooming. And because we had such a mild winter in the Midwest, everything is blooming all at once, early, and it's been really hard for a lot of people. So obviously the treatment is just, avoid the trigger as much as possible. You still have to go outside, natural antihistamines. What clears histamines? Vitamin C. Vitamin C, even high dose. This time of year, I will take 8,000 milligrams a day.
Wow.
My baseline is 6. So, I can, as long as you don't get diarrhea, you can go up to, 15 grams a day. Wow. Everyone knows about quercetin because it was so amazing for COVID. That's number 2. Our AHIS has kind of the most important things. AHIS has, the quercetin, the bromelain, the stinging nettles, the N-acetylcysteine. So those are the biggies. That plus high-dose vitamin C, for most people, that's all that they need. If you look at vitamins and you're not shopping at our store, if it says folic acid and nothing more, then that's the cheap folic acid that, people who seek out holistic health are usually the strong-willed, independent thinkers, and they're pretty much all undermethylators. Yeah. 100% of Olympic athletes are undermethylators. What normal person would kill themselves 8 hours a day to get a little medal? And that's you and I, but that's not the average person.
Yeah.
Yeah.
Okay, well, that's good to know. So, because I know that's something here in the office he specifically talks about a lot is the methylation system. So we might need to do a whole episode on that.
That's we can bring in my poster and we can talk about that.
But that's good to know. So then as far as how does that differ from asthma if you're treating asthma?
Yeah, so if you have asthma, it just means your lungs are sensitive, for whatever reason. So you already have a little bit of inflammation. So again, my job is on a daily basis, we should do everything to keep the inflammation in our body down. But then we get a trigger, then our lungs are so inflamed that the little muscles go into spasm, and that's what causes the difficulty breathing. Because you got these little air sacs and the little tiny tubes going in. Tiny tubes. If they get blocked up with mucus and inflammation, then you can't breathe, then you can't exchange oxygen. And then that's such a scary thing. Then you kind of have anxiety, and anxiety actually releases all these different chemicals and hormones that makes inflammation worse.
Yeah. And I know with allergies, obviously it can be hard to pinpoint certain things, but I know like the weather app now and certain things will tell you what's super high that day. So you can probably pay attention to that. Like I know for me, tree pollen are always the days I feel worse, and there's dust and dander and things like that. So I know you can look at that, but Asthma is a little different. What kind of triggers are you talking about when you talk about asthma?
Yeah, I mean, sure, for me, it's definitely the environment, but what's the underlying thing? So food allergies. When I was a kid, I almost died. My parents had to rush me to the hospital all the time. When I played football at the end of practice, I couldn't breathe. When I stayed over my grandparents and slept on feather pillows, I woke up and I couldn't breathe. And I don't know why I didn't go to them. I went outside, it's 50 degrees, and I was almost froze to death, but at least my lungs opened up.
Yeah.
So just avoiding the triggers, minimizing inflammation. For me, the most common food allergies: gluten, dairy, soy, eggs, and peanuts. When I stopped eating those 5 foods, my asthma went away.
Yeah.
If you see a kid with allergies or chronic ear infections, almost always that's a dairy allergy. So again, just stop the inflammation before you get the exposure, and that's food. Your environment, as you know, over 1/3 of every home has mold in it. So if you're exposed to mold all the time, that super sensitizes your body. Your immune system is out of balance to begin with, and then the mold toxins are causing this inflammation. So mold is huge. As you know, heavy metals just exacerbate the condition. And then just animals. If you're allergic to cat, I have this argument all the time. But if it's just allergies, that's one thing. But if you're having asthma from your pets, either you get a different little home outside the house that you can go to them. There is some things you can spray on your animals once a week to help decrease the dander. That really does help. But if you need to get a pet, just get hypoallergenic pets. It's $1 billion industry, and there really are hypoallergenic pets, because I can be around some cats, but most cats I can't.
So then when you're like in traditional, I know my husband has asthma, so like I know you can get an inhaler.
Right.
So what exactly does that do?
It's a bronchodilator. Right. So albuterol is amazing. It costs nothing now. Everything's generic for that. So the baseline is, if you have the bronchospasm, if you have asthma any significant degree, you have to have a bronchodilator. You need to keep it on yourself. If you have it in your car, people die of asthma. Even if it's not you, you can save someone's life.
Yeah.
Okay, that's number one. And then anti-inflammatories. We don't like too much steroids, not good for you, but just a little bit they put in a puffer. Ceravent was the most famous one, and now it's generic and very inexpensive. But if you need it, just that little puff of steroid twice a day just takes away the inflammation.
Yeah.
And nebulizers. Everyone should have a nebulizer. Nebulizers are so inexpensive now. There's I take my little, in case anyone gets COVID while I'm on vacation, there's a portable nebulizer that basically small, maybe 2 cell phone size. And that's all you need with today's. So it goes in your suitcase. So, everyone needs to be prepared. Oh, and lastly, a peak flow meter, especially for children. Kids, you can't tell. So if they can't blow in this little, $20 apparatus that's plastic, and they can't blow the air high enough, your kid's in trouble.
Yeah.
So that's absolutely mandatory.
Yeah. So what exactly is a nebulizer? I know.
Yeah. So right. So it's just amazing. This little machine. You put the albuterol and normal saline in this little reservoir. You put on the top. You wear a mask. Turn it on, and there's this mist for maybe 10 or 15 minutes of this bronchodilator and anti-inflammatory steroids, and it just gets into your sinuses and your lungs. It takes 10 or 15 minutes 2 or 3 times a day, and you're back to normal.
Yeah.
If you have COVID, any respiratory, and since we're not just, if you have an infectious process, hydrogen peroxide costs a few dollars. Everyone needs to have that in their home.
Yeah.
That and saline, any respiratory germ, within 10 minutes, the COVID symptoms would be gone for at least 4 hours. All the bronchodilation would be gone. You can even add the steroid and albuterol to the hydrogen peroxide if you need to.
Yeah, they're amazing.
So that's not it's so inexpensive. Every household should have it.
Yeah.
You have someone visiting you, want your visitor to die. So just
right.
knowing how to do that, it's amazing what that does for people.
Yeah. How do you use that hydrogen peroxide with your nebulizer?
So it's 3% food grade hydrogen peroxide, which some drugstore sells. Otherwise, you can always buy it from Amazon. And everyone can do. Dr. Mercola says 50-50, but I experiment with myself. Anything more than 1/3 hydrogen peroxide, 2/3 normal saline. Anything more than that, there's a little mist that goes by. It just would burn my eyes. Some people burns their lungs. So you've got the saline and you've got the hydrogen peroxide, and you just need to decide what tolerance do you have. So for me, it's 1/3. But I have people that say, and Some people say they can do straight hydrogen peroxide. I can't imagine that. But again, it's only 3%, but still, I would say 1 part to 3 parts.
Yeah, work yourself up and
and just work and see what works. Right, exactly.
Well, and I think that's a huge, if you're a listener of the podcast, I think it's very important to understand that holistic medicine is very much, you need to be hypersensitive to your body. So triggers, what's triggering your, food allergies? Watch your food. What's going on in your environment? Did you sleep on a feather pillow on vacation and you're all of a sudden you're you're clogged up? So I think that's a huge note. If you're not ready to do that, you might not be ready for holistic medicine, because that is such a huge thing that we do. And I think most people do that today, but I think if you're going to be, taken care of and healthy for the rest of your life, and it takes a couple weeks to pay attention to what you eat, what your environment is, it's totally worth it.
Right. Yeah, I mean, so everyone should be on vitamins. We call it our immune pack, a multivitamin. If you have allergies, you're by definition under methylator, so it's got to be the good vitamins, the methylated vitamins. Vitamin C is mandatory, and vitamin D. Vitamin D controls your immune system. If your immune system's hyped up, you're more likely to overreact to things. So vitamin D is critical. Have the levels done. Zinc. Most people in America are zinc deficient. Have the number one mineral. Omega-3. Whether you get from your diet or supplements, is very anti-inflammatory. So we love omega-3, particularly during asthma and allergy season.
Yeah, zinc, I started taking it again, and it's helped with so many of my symptoms.
And your skin, your hair, for if we haven't worried about your beauty, you want zinc.
Yeah, it's incredible.
Everything for your body, yeah.
So we have a question from one of our listeners, and that question involves emotional triggers when it comes to asthma. Her asthma in particular was triggered by the death of her parents, and she only experiences at night. So what does that look like?
So number one, the root cause is there is some inflammation in your lungs. So do maybe a food allergy panel or just an elimination diet. That's important. Just look at your environment, look at your diet. But what's happening is, so if you're at night when you're dreaming, your heart rate goes up. You're almost hyperventilating in your sleep. We already have inflammation, so you're breathing fast, you're drying out your lungs, and then when they get more dry, they get more inflamed, and then they're more likely to have spasm. Also, when you're stressed, your body releases neurochemicals that cause inflammation and can induce bronchospasm. Just from the anxiety attack, you actually cause inflammatory mediators that initiate that. And then with everyone, emotional release. For anyone to heal, the root cause of most chronic diseases is some type of emotional traumatic event. And there's many ways to have emotional releases. And number one, have the emotional release, take away all the inflammatory processes. And same thing, just have your little albuterol on the side, short term, but long term, if it keeps happening, you're just missing the root cause.
Mm-hmm. Yeah, and that's why functional medicine is so important, because you might not understand that it's linked to your emotional trauma, but he would be able to tell you that. So that's super helpful. Anything else you want to touch on before we finish up?
Yeah, I mean, just, take control. I mean, the key with functional medicine is, you have to take care of your health. If you're by yourself, I mean, I as older I get, I like to be hiking by myself and doing things. And if you get in trouble, you're responsible for yourself. No one else is. So before you go for that hike and out in the woods, you need to make sure that you've taking care of your sleep, your diet, you're doing everything right. Overbooking yourself, that's probably the biggest concern of health in America right now. But everyone's trying to do 10 things at once. My grandfather opened one piece of mail a week, and we open 100 emails a day. So we're just so overburdened with stress, and minimizing stress and taking time to eat healthy, be healthy, eat healthy foods. A lot of people can afford healthy foods, but they don't have the time to get them. And you just need to find a system.
Yeah. And I think for me, what helped is like journaling, like even on my notes app on my phone, saying like, this particular day, this has been really bothering me. And then I kind of noticed, okay, tree pollen for me is, and obviously don't obsess over it, but it is so important to listen to your body, because it will tell you what's wrong.
Right.
And then we're here to help you. So for the average person like myself, I will take a Zyrtec or a Claritin or do a nasal antihistamine. Is that okay? Or should we be turning away to something more holistic and treating that inflammation, or is that okay in the short term?
Absolutely short term. Yeah. Especially, in your car, you can keep Zyrtec, your nasal spray for a year. It's probably not going to degrade, where everything we use is natural, can biodegrade. So, but if you're having to use it every day, we don't like it. And what do we not like about antihistamines? anticholinergic. Your brain uses choline, so literally increased risk, long-term dementia, memory problems. So long-term antihistamines, no, but short-term, absolutely. They're very inexpensive. They're all generic. Any of the over-the-counter antihistamines just work miraculous for me.
This month, like I said, allergy asthma. So you can get 15% off all of our allergy asthma medications with a code. It's ALGY15 on our online store. So get on there. The link is in the bio. And hopefully you start feeling better with all of our tips. So we do read your questions and your comments. So please, if there's anything you want to hear about, we are going to talk about menopause soon, healthy aging, things like that, skin. So anything you guys want to hear about, please feel free to write in because we do read those and we really appreciate you guys.
Thank you for listening to the Optimal Wellness Podcast. Subscribe now to get monthly episodes to help you achieve your wellness goals. And if you'd like to learn how we can help, schedule an appointment at Health and Wellness of Carmel today. Just go to HWOFC.com or call 317-663-7123.